Hi, my name is Joanna Johnson. I am the Care Management Supervisor at Jewish Family and Children's Service, and I'm going to talk to you a little bit about poverty in the Jewish community. Um, First, let me talk to you a little bit about what we do. The program I work with is for clients under the age of 65. Everyone we work with is Jewish. The target audience of this program is vulnerable Jews throughout the 5-county Philadelphia area who are facing crisis due to chronic illness, job loss, family discord, limited financial resources, domestic violence, trauma, or grief. The first thing I want to say is that there's an ongoing myth in the Jewish community that poverty does not exist, that everyone has enough money to make ends meet. But I will tell you that in the past year, we worked with over 600 individuals who are under 65. You'd probably at least double that number if you counted the senior population we work with who are also in poverty. We help those who are in need of food, utility assistance, prevention of eviction, foreclosure, and a number of other financial issues. One thing in Philadelphia to talk about is in 2009 there was a Jewish population study, and they found that 2% of the population of Philadelphia are currently unable to make ends meet, and 26% are just managing to make ends meet. So of that 26%, that's about 55,000, over 55,000 individuals. That's a lot of individuals in the Philadelphia area, and that would make up the bulk of our population that we're working with, because at any moment they are potentially going to fall into crisis. In addition, that population study also found that 4% of households reported that they had to skip meals in the past 12 months. So those are some basic statistics about poverty in the Jewish community in Philadelphia. In terms of the definition of poverty, there's the federal poverty guidelines, which are set by the federal government. For 2012, a family of 4 considered make at 100% of the federal poverty guideline makes $23,050 for the year. So that's about $1,900 a month for 4 people. The majority of programs, federal programs that are able to assist families who are in poverty are around 150% of the federal poverty guideline, maybe slightly higher for programs such as food stamps. So that would be for a family of 4, $34,500 and $75,000 for the year. $34,575 for the year. That does not go very far. I also wanted to just give you a couple other basic statistics. In 2011, a study found that 49% of Americans are living paycheck to paycheck. We are currently seeing, with the bad economy, a major trend where families who previously were fairly stable, middle class, upper middle income, are now have fallen and are living. That's a pretty large percent living paycheck to paycheck, and certainly I think that's represented in the Jewish community. So I'm going to talk to you a little bit about who we see, and I think just to give you a little background about JFCS, the Care Management Department, what we do is we work with adults who are coming mostly for financial purposes, although we have a number of services at Jewish Family and Children's Service. specifically, people are coming to help prevent a crisis. So the two major differences in our clients are we have chronic clients and episodic clients, and I think that's represented in the Jewish community in terms of poverty. We have the chronic clients who are homeless, who are on disability. They may have psychiatric issues or chronic medical problems where they're living on a fixed income, they have no income, and their situation is an ongoing situation. That's certainly a large percentage of our clients, and that does exist in the Jewish community. There's also our more episodic clients, which unfortunately in the last few years, particularly due to the economy, this percentage of our clients has grown, which was those families who previously were middle or upper middle income families who have experienced either unemployment that's lasted for a unintended long period of time. They've experienced a divorce, death in the family of one of the husband or wife, or just a change in their whole family situation due to a number of factors. Those are the clients who never expected to come to Jewish Family and Children's Service. They previously may have been donors to our agency. You will likely see them if you're working, in a synagogue, in a JCC, in a camp. You're going to see these are the people that we see and that are struggling on a day-to-day basis. Let me start by giving you a couple of vignettes of clients that we see, just to kind of give you a little bit more personal idea of what we're dealing with. The first woman I want to talk about is Susan. Susan came to us about 3 years ago. She lives on the main line. Her kids went to Jewish day school. She worked part-time as a preschool teacher, but her husband was the main breadwinner in the house. And, seemingly very normal life. Her kids went to overnight camp. And through in a very relatively short period of time, Susan's life basically turned upside down. Her husband became addicted to prescription drugs, lost his job, Susan found out. He actually ended up going to jail for this. And so basically Susan was left to deal with a mess. After her husband left, she found out that the house was in foreclosure. Utilities were on the verge of being shut off. Her car was on the verge of being repossessed. A whole number of issues that she was not aware of until because her husband was previously responsible for paying all the bills. This was a pretty drastic change. Susan went from being a virtually stay-at-home mom, is what she described herself, to applying for food stamps, applying for cash benefits, coming to Jewish Family and Children's Service for help paying her utilities to prevent them from being shut off. She's continued to have ongoing issues. She recently, one of her sons was bar mitzvah age. She did struggle, but was able to put together a very basic party for him. It was, she struggled a lot because it was very different than her older son's bar mitzvah. But she's really done a great job. She's been able to attain employment. She's still, continuing to receive some benefits. We've been able to work with her. We have a credit counselor on staff. We've been able to help her modify her mortgage so that she can stay in her home. But this is an example of someone, and we have a number of clients who are in the same situation, who you may never expect. She's a very private person. although this situation was fairly known in her community because of, her husband going to jail, that's not very easy to hide. She has really done a great job of turning things around, and with the support of our agency, the Jewish community in general, and her own hard work. Another different type of client, a more chronic client, would be a man that we saw named Sam. And when we met him, he was living in North Philadelphia in a very rundown home he had a roommate. And the roommate, it was a very abusive situation. They both had mental health issues, and he and the roommate were fighting a lot. The fighting escalated to a point where his mental health condition was deteriorating. So what we ended up having to do was go with him to commit him to, he committed himself actually to an inpatient stay in a psychiatric hospital for about a week. We moved him out of his home, put his belongings in storage, and he ended up living in a shelter for a few years. We continued to work with him throughout this process, and recently he has gone through a program where he's able to move into an apartment at a subsidized rate. He's living on a fixed income on SSI due to his disability, so he's able to afford his apartment, and is still needing the ongoing support of our agency to, make sure that he pays his bills on time and gets all the services that he needs. So we have two opposite ends of the spectrum of clients, but and we see people anywhere in between, but just to kind of give you that perspective. Let me talk to you a little bit about where we get our referrals. They come from rabbis, family members, friends, neighbors, synagogues, JCC camps, all kinds of different referrals. And I understand that most of you will probably be in a situation where you're going to see these clients, these families. They're clients to us. But you will see these families, and I think a lot of times in the Jewish community, people they're not going to put their problems out there. They're extremely embarrassed, extremely private. Maybe they'll go to a family member or a friend, but often at a synagogue, sometimes I've seen people who would rather let their membership go than let the synagogue know that they're having financial struggles. So I think it is important with any possibility to have these conversations and to try to facilitate an environment where people feel comfortable to come to, in confidence to a rabbi or a professional, and let them know that they are struggling. Because a lot of times what happens is people will explore every other option that they can before coming to a nonprofit agency for help, or applying for food stamps or benefits. They are really hoping that their problem will be resolved, or that a family member will be able to help. And often they come to us and it's the 11th hour and they're being, they're going to lose their house in a month or tomorrow, and it makes it very difficult. It's always easier to prevent a crisis, I think, and try to encourage people to utilize the resources in their community, because that's why they're there. So again, we try, and I think there's no easy way to do it, but to try to make people feel as comfortable, to make it known that there are resources out there that can help with prevention. You do not have to, have a chronic problem, and we have a number of services in addition to our agency. There's a number of wonderful Jewish agencies that can help with jobs, food, a whole host of issues. So I'm also going to talk to you a little bit about what we do when we see someone. The first thing we do, because we see such a range of individuals from the community, is we start with a comprehensive assessment. We look at their education history, their job history, any kind of medical conditions that might prevent them from being able to work. And then what we do is we work to connect our clients with services, such as we have a credit counselor on staff. If they're experiencing a major life change or are overwhelmed by their situation, we have therapeutic counseling. That's certainly an important component to their recovery. We also help apply for public benefits such as food stamps. Just a little fact, the monthly income that you can receive for a family of 4 is about $2,900 a month and still qualify for food stamps. There's a lot of myths out there about who's eligible, whether you have to be on welfare or you can't be working. In fact, it's a really great program, and we encourage a number of people as many people to apply as possible. We also then connect clients with other resources, such as in Philadelphia, there's the Jewish Relief Agency that helps deliver food once a month. There's a number of other local organizations, and I'm sure similar organizations around the country. And then what we do is assess their issue, and if their major issue is that they need help paying a utility bill, then we will try to work with them on a plan of how they're going to be able to pay it in the future, work on a arrangement with the utility company, and then we utilize some of our funds to help prevent that shut off and ensure that they will be able to pay things moving forward. We collaborate with a number of community resources in the Jewish community and outside of the Jewish community. And the most important thing is to be there as a source of support and try to treat people with dignity, because this is obviously a very challenging time for them. So I hope that this gives you a little insight into poverty in the Jewish community, and specifically what we see on the other side, what individuals may present to you may be somewhat different, and I want to kind of let you know what services there are available. And I would definitely encourage you to have families or individuals contact their local social service agency, and we will do what we can to assist them. And I will thank you very much.